coronavirus is a global contagion, and on that note, we begin with our top focus coming in from the United States, as the deadly coronavirus pandemic has killed 865 people in the United States in just the last 24 hours. This is the highest death toll that has been recorded by the United States ever since the pandemic hit the world. The number of positive cases and death toll in the United States has also surpassed that of China, the place where the virus was first detected. Now, US President Donald Trump has warned that Americans of two tough weeks ahead and has predicted thousands of deaths in the coming months. In his address at the White House, he also called for people to mandatorily follow all guidelines for the next 30 days.
This is going to be one of the roughest 2 or 3 weeks we've ever had in our country. We're going to lose thousands of people. When I see 28, 29 people from the governor of New Jersey, 29 people. When you see 173 people died in New York yesterday, or whatever the number was, I think it was more than that. When you see the kind of numbers that we're witnessing, we've never seen numbers like that. So it's easy to be negative. And then everybody can be negative. But I'm a cheerleader for our country, and I want them to do a great job so the number can be kept. And I've always said it, I want as few a number of people to die as possible. And that's all we're working on.
Donald Trump also promised that experts and other scientists were working around the clock to fight the lethal global crisis. He appealed to the people to brace themselves for the painful times, but also asked them to be hopeful, to expect positive results soon.
A very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. When you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible.
Let's get in a sense of ground zero, and for that I'm joined in by our correspondent Jagrati Dave, who's joining me live from Washington DC with all the details. Let's quickly go across to Jagrati. Jagrati, a very good morning to you. Now, we just heard Donald Trump warning Americans of some very painful 2 weeks which lie ahead. What did Mr. President and the White House task force have to offer in today's press briefing?
Well, today, the President and his advisors went through the data that was behind the decision to extend social distancing to the end of April. If you remember, previously the President had suggested that the economy could reopen by Easter, but that clearly is not possible, and his mind has been changed based on the data that was presented by Dr. Birx, the coordinator of the coronavirus, the White House's coronavirus our unit, and Dr. Fauci, who is one of the US's top experts on infectious diseases. And the modelling suggests that even with mitigation, 100,000 to 240,000 Americans could lose their lives to coronavirus. And they want to keep trying to flatten the curve and try to encourage Americans to engage in social distancing measures to try to prevent that number from being to that level. But today really was a presentation of the data. The President's tone was very different, and it has been increasingly different to his tone and his language earlier on. He described the next 2 weeks as painful. He's called the virus vicious, and he has clearly understood the severity of the pandemic and of the impact it will have on the lives of Americans.
Right. Jagrati, let's now also focus on New York, which is the epicenter. The New York governor, Andrew Cuomo, has complained that states have to bid for ventilators, competing with other states, something that has been dismissed by the US president. What do you make of the state of affairs at this point?
Yes, there are tensions from between the state level and the federal government level. Andrew Cuomo, the governor of New York, is overseeing the epicenter, essentially a state that is the epicenter of the crisis in the United States. And he's described, states bidding amongst each other for ventilators, a bit like being on eBay with 50 other states. And he was this was put to the president in the briefing, and the president was saying, well, states shouldn't have to bid like this because they'll up the price, of these bits of equipment. They should phone us up, and we can help them. The president is really adamant that they're doing a good job, and that the equipment is being given to states as and when they need it. He keeps talking about the stockpile of 10,000 ventilators that is needed for emergencies. But you look at the numbers here, and Andrew Cuomo is saying that New York needs 30,000 ventilators, which is a number far bigger than the stockpile that the federal government has. The president seems to suggest that some states are asking for more bits of equipment than they actually need. But there's also been some issues about some states getting more than what they requested. Some states, Florida, for example, is a state that's gotten everything that it has requested. Other states haven't. So there's clear sort of supply chain issues in the process of supplying kit, but also questions about shortages. Are there enough ventilators? Is there enough equipment for frontline staff, for health workers who are tackling this crisis?
Right, supply chain issues and shortages, that's a very valid point that you've made. Should other cities be learning from New York's case? And on that note, we must also talk about Detroit, which medical experts believe is all set to become America's next COVID-19 hotbed. Can the Michigan city be averted from meeting the same fate as that of New York?
Well, that is exactly what the health experts were saying in this briefing today, that their aim is to try to prevent hotspots, to prevent spikes in places like we have seen in places like New York and New Jersey. So on the graphs that they showed, the spikes of New York and New Jersey, some of the reasons for that were obviously the vast amounts of travel that in and out of a big city like New York. But other metro areas are areas that they are looking to. Chicago, the DMV, the Washington DC area, metro cities like that, they are trying to keep as flat as possible. They pointed to cities like Los Angeles and Washington. Washington was one of the first places where the virus emerged in the United States, and its peak has not been as severe as that of New York. So that's clearly something that health professionals are looking at, and this is what they're looking into their modelling. At the moment, the death toll, they say, between 100,000 and 240,000, the latest model suggests, is taking into account the spike in New York, which they say could skew the figures. But if they can keep the other metro areas and the other metropolitan areas flatter than New York, then maybe the overall death toll could be much less than the models, the extremities of the models that have been put forward today.
Right. Jagrati, forgive me for a slight digression, because the last day of the month in an election year in the United States is also a major fundraising deadline. But how do you fundraise in the middle of a pandemic? How presidential campaigns are fundraising right now?
Well, this is unprecedented. At the moment, the efforts of the government are clearly directed at mitigating the worst effects of this pandemic. The economy is something that the president has been able to fall back on as a campaign tool, as an argument to try to convince people to vote for him, because the economy is being strong under his watch. But of course, shutting down the economy because of a pandemic, all essential businesses in several states across the United States have been closed. There's stay-at-home orders, so people aren't going out of their homes unless it's for essential activities. So all of this is a cumulative effect on fundraising, on campaigning. At the moment, it seems that the president has said in these briefings that the economy is not his top priority, saving people's lives is. And that is a concern that every government across the world is clearly grappling with. But of course, this year, with the election coming up in November, it is going to be unprecedented, an election following a global pandemic which has really uprooted the rules, the normal rules leading up to an election.
Absolutely. It is going to be, it is unprecedented already. We'll have to wait and watch how the pandemic actually impacts the upcoming elections in the United States. On that note, thank you so much, Jagrati, for joining us on this newscast and sharing your views with us.
If you look at our AIMS hospital, we have patients who are on ventilator for years, months or weeks. And here itself in this cubicle, we have all these patients here for years together. And the only reason we're not able to send them back home is because they need to be sent on a ventilator. And other patients who are waiting for, we have a waiting list of more than 5 years.
if I rewind back around 1.5 2 years back, so it all started with discharging this patient who's Sachin in this case. So we gathered around that patient. We said, hey, listen, he's there in AIIMS from last 4 years, and we need to discharge him, and we need to make a device that he can take back home.
At that time, and even today, there is no cost-effective ventilator available in India. The cheapest ventilator which are there, portable ventilator, cost around 4 to 5 lakhs, and most of them are bulky, require technical expertise, and not at all user friendly. Compared to normal ventilators, this device, if you look out here, this is extremely portable, very small, weighing less than 3 kgs, and it runs off an Android phone. So one thing we realized was that most patients and relatives, they own a smartphone, and we wanted something to make which was very user friendly. So we designed an app.
Have a look at the traditional ventilator. This is how big it looks like, but at the very same point of time, this is the size and the form factor of our ventilator. So it is exactly the same as the traditional ventilator, while being a fraction of its size and the fraction of the cost as well. Now, if I talk about this ventilator, this comes with a lot of shortcomings where our ventilator actually supersedes. So when we talk about this ventilator, it needs oxygen supply, it needs medical air. So if a person wants to take it home for a long-term ventilation, he cannot take it over there. Whereas with our ventilator, you simply plug it into the socket and it works just fine.
We have prices less than 50,000 rupees. That's the basic price for the basic version, and the running cost is less than that of a tube light. Easily 5 years shelf life is there for this.
इसके वेंटिलेटर लग गया, हाथ पैर कोई काम नहीं करते थे कि एक बंदा तो हॉस्पिटल 24 घंटे रहता ही था, मतलब चाहिए ही रात और दिन। हम वहाँ पर रोते थे, हम बहुत दुखी थे, हमारा कोई देखने वाला भी नहीं था। हम वहाँ पर किस तरह गुजारे हैं 5 साल, हम एक एक रुपए के लिए मोहताज हो गए, और न हमारा कोई कमाने वाला, हम अकेले थे।
उनकी वजह से आज 5 साल बाद हमारा बेटा घर पे है, और हम अपने घर को भी देख रहे हैं और अपने बेटे को भी देख रहे हैं।
दिन में तो मैसेज रहती है, वो देखती रहती है, हम अपने काम पे चले जाते हैं, अपना काम ध्यान रखते हैं। इस वेंटिलेटर से हमें इतना फ़ायदा हो गया कि घर पे आ गए, अपना घर भी देख सकते हैं, हम अपना रोजगार भी हम चला सकते हैं इससे। घर पे आके खुश है, ये भी घर पे अपने बहन के साथ है या सबके साथ रहता है, खुले रहता है यहाँ पर।
Anyone can go ahead to our website and buy this ventilator. More than 30 to 40 hospitals who are actually using it right now.
There is a acute scarcity, and I would suppose that around 1 million ventilators are urgently required across India right now. So here our ventilator fits in perfectly because it can be used at home, it can be used in the ward, it can be used as an ICU advanced ventilator, and yes, it can be used in the ambulances also.
जब से सचिन घर पे लेके आए हैं एम्स से, तो वहाँ पर 3 या 4 बच्चे अभी और वेंटिलेटर पर ही उसी कमरे में हैं। तो वो भी अब जाने की घर की तैयारी करें, वो भी करें हमें छोटा वेंटिलेटर हमारे पास भी लगाइए, हमें टेस्ट के दिए, हमें भी घर जाना है। सब बच्चे ये कह रहे सचिन घर चला गया है, हमें भी घर जाना है।
Greetings, citizens of the world. This is Anonymous. After our previous coverage of the growing coronavirus outbreak and the associated quarantine lockdowns, our supporters have asked us what we expect to happen in the coming weeks and months. It would be impossible for us to truly predict the future, especially in a situation that is developing so rapidly, but we have been keeping a close eye on this situation, and we are comfortable enough in our research to make a few predictions about what lies ahead. These are simply predictions and are not to be interpreted as statements of fact. As always, you need to do your own research. One thing is for sure, we are only seeing the very beginning stages of this pandemic, and this is something that experts from around the world agree on. The United States and Europe have both been relatively safe from deadly outbreaks in the past several decades, but it appears that their luck has run out. In fact, these areas may end up having things much worse because they have refused to take this issue seriously early on. Citizens of Italy are now regretting the cavalier attitude that they had in the early days of the outbreak in their country, and are now warning others that this pathogen is far more dangerous than the seasonal flu. Unfortunately, no one seems to be listening to these warnings, especially in the US and the UK, which will likely end up as global epicenters as a result of their inaction. In the United States, officials are finally starting to realize that the illness is about to explode domestically, but for a variety of different reasons, citizens of the country would never voluntarily participate in the kind social distancing that is needed to slow the spread. This will serve as a perfect excuse for the US government to declare martial law, a process that has already started to happen with President Donald Trump's recent national emergency decree.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
The National Guard is already active in multiple cities across the country. Seattle, Los Angeles, and New York City will likely be under a Wuhan-style quarantine lockdown within the next several weeks.
Concern that we can have outbreaks of that proportion in multiple U.S. cities. If you look at Wuhan...
A Wuhan style.
You're
saying the numbers that we are seeing and have seen in China.
Right, in a major U.S. city. Remember, Wuhan was the size of New York City. At the peak of that epidemic, they hospitalized about 20,000 people. 10,000 were in serious or critical condition, and 2,000 were intubated. To give you a basis of comparison, New York State, the entire state, has 50,000 hospital beds and about 3,000 critical care beds, and about 20,000 of those beds are in New York City. So if we have a Wuhan-style outbreak in New York City, that's going to overwhelm the system. So they need to be building surge capacity right now in anticipation of that possibility. Now, there's ways to avert it, but that's the risk that we face right now.
With no one allowed to enter or leave the cities unless they have special permission from the government, which will be very difficult to obtain. Our sources in the states believe that New York will be the first city to go into lockdown, since the numbers of cases are growing exponentially in the city, and the governor of the state has expressed in a recent press conference that such measures would not be ruled out. The New York Times has reported that the city's most wealthy citizens began to flee the region after hearing rumors that a lockdown was imminent. Around the same time, The Guardian spoke with private jet executives, who revealed that there has been a surge in business over the past month because the super-rich are all fleeing to their multi-million-dollar doomsday bunkers. If the virus or the military-style lockdowns have not hit your neighborhood, you may still think that this is a joke due to the misleading statistics, but whether you realize it or not, your life is about to change in a big way. There is a very real possibility that U.S. elections could be suspended or canceled as a result of the coronavirus. In fact, primary elections in the country have already been delayed as a result of the outbreak, and there is now a poll worker shortage as well. Presidential candidates are even beginning to cancel their events, and there are already a variety of different publications that are making predictions about the possibility of a canceled election. What we are likely seeing is a new Great Depression that will totally reorganize the global economy in ways that are currently impossible to predict. The initial lockdowns in China created a supply chain disruption that resulted in a global downturn in the markets, and this was to be expected considering that China is now the manufacturing center of the world and many people were out of work for an extended period of time. For the United States, the consequences of the situation could have been temporary, but the Federal Reserve has made a number of reckless moves in a panic to keep the markets afloat. First with a $1.5 trillion cash injection for Wall Street, and then by slashing interest rates to zero and printing more money, which will cause inflation and decrease spending power for the average person, likely resulting in an economic depression.
The financial markets have been caught within the throes of an unrelenting downtrend over the past several weeks, which has reached a boiling point today after the U.S. benchmark indices posted one of their largest one-day sell-offs in decades, leading Bitcoin and all other digital assets to similarly plunge. Now, the NY Fed is conducting a massive liquidity injection into the markets in an attempt to ease fears regarding companies' access to capital. This $1.5 trillion capital injection is being referred to as the Fed firing its nuclear weapon by analysts and could have impacts on Bitcoin and all other assets.
This virus will not destroy humanity. This is something that our species faces from time to time, but sadly very many people will be lost in this tragedy, and all of our lives will be impacted by the time this thing is over. When the dust settles, we will be waking up in a different world, just as we did on September 12th of 2001. There will be new agencies and bureaucracies to enforce new medical laws, and these governing bodies will likely be global. As we have seen with the tragedies of the past, the people in power will use this crisis as an excuse to accomplish goals that they have been working on for a very long time. We are anonymous. We are legion. We do not forgive. We do not forget. Expect us.